بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا المرسلين وعلى آله وصحبه أجمعين. Assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers and sisters, it gives me great pleasure in seeing you after a long time and talking you through the coronavirus UK vaccination programme. Inshallah, I'm hoping to give you a succinct presentation to explain the vaccine, and I hope that this will bring you benefit. Please feel free to share the resource amongst friends and family. Inshallah, you'll be credited with the reward. Okay, screen sharing, play from start. Okay, so what do you need to know? So in this presentation, we will be talking about the scale of the problem and the ethnic minorities conundrum. What is the solution? What is vaccination? How does it work? What is the UK vaccination programme? And we'll go through some of the common myths. But before we do that, I just want to run through spiritual perspective on vaccination, because there's a lot of confusion and a lot of people actually going to imams and sheikhs and scholars and asking, is the vaccine allowed? Whereas in fact you should ask the people of knowledge in the relevant field. So the first principle from the Maqasid al-Sharia is that of sanctity of life. So Allah subhanahu wa ta'ala says in Surah Al-Ma'idah, he who saves a life, it is as if he has saved the whole of mankind. And the corollary is that he who takes a life, it is as though he's taken the life of the whole of mankind. So this is very, very important, because by getting vaccinated, you can save many, many lives. But by being irresponsible, by not engaging with the vaccination programme, by not keeping a social distance or wearing a mask, you could cause many people to suffer and ultimately lead to their death. The second principle is preventing other people from your harm. So the Messenger of Allah sallallahu alaihi wasallam said, the Muslim is the one from whose tongue and hand the people are safe, and the believer is the one from whom people's lives and wealth are safe. And this is in Sunan al-Nasa'i. And the key thing here is that actually this is not just about verbal harm and physical harm. This is the whole principle of not causing harm to others and wanting for others what you want for yourself. And that good character extends even to, even to vaccination, really, because it's about the public interest over your own over your own sort of ego. Ultimately, I mean, if the interesting example I find in the life of the Prophet ﷺ was that he would brush his teeth, or not go out if he'd had garlic or raw onions, or he would avoid eating those foods because he didn't want to harm people with bad breath. He didn't want to offend them. It's not in keeping with the character of the Prophet ﷺ to do that. And yet, the breath that we carry is a lot more toxic. It could kill people. It's a killer breath, because we don't even know if we're carrying COVID. And that would not be in keeping with the example of the Prophet ﷺ, where, we know that potentially we could harm other people. The third principle is that of seeking cure. And the Prophet ﷺ said, verily Allah subhanahu wa ta'ala sent down the disease and the cure. So we know this coronavirus is from Allah, and the cure is from Allah as well. And for every disease he made a cure. So there is a cure for coronavirus because Allah subhanahu wa ta'ala has told us this. So seek treatment, but do not seek treatment by the unlawful. So it's an encouragement to seek treatment and to see this life as a stepping stone to the next life, as a gift, as an asset. Every breath is a priceless jewel, as Imam al-Ghazali says, and we need to use our lives in a good way. But of course the treatment shouldn't include haram things unless there is no absolute alternative. The fourth principle is that of tawakkul and reliance on Allah subhanahu wa ta'ala. So in the famous hadith, the Prophet ﷺ said, tie your camel and make dua. Now, obviously, we can make dua to Allah subhanahu wa ta'ala to lift the pandemic, but what practical measures are we taking to tie a camel? And then we have the hadith of the fly. Okay, so from that point of view, we should make an effort to seek the cure. Tie a camel and make dua. Then the hadith of the fly, which I find particularly pertinent, There's a degree of cognitive dissonance here whereby we find it hard to understand how things work sometimes. So the Prophet ﷺ said, if a housefly falls in the drink of any one of you, he should dip it in the drink and take it out, for one of its wings has a disease and the other has a cure for the disease. And that's in Sahih Bukhari. Now, we know that this sounds absolutely absurd. However, by the same token, it's a bit like vaccination. Well, the virus causes the disease, but we are taking part of the spike protein, part of the virus, to actually find the cure. And lastly, there is a reward of the patient. So Allah subhanahu wa ta'ala has told us, and we will most certainly try you with something of fear and hunger and loss of property and lives and fruits, and give good news to the patient, Bashir as-Sabirin. And the reward of patience is unlimited. In this scenario, the patient is in, dealing with death, dealing with illness, but also in compliance with things like masks and social distancing and things that protect us and protect other people from our harm. So a bit about the background of coronavirus. So in December 2019, there was a case of severe pneumonia in Wuhan in China, which was found to be due to the coronavirus SARS-CoV-2, which caused the illness COVID-19. Coronaviruses cause illnesses in animals and humans, ranging from mild illnesses such as the common cold to more severe disease such as SARS and MERS. In January 2020, we had the first 2 cases in the UK and the first death in March 2020. The World Health Organization declared a pandemic in March, and the first UK lockdown took place later that month. So this is an image of the coronavirus. If you can see here, this is the cell wall, cell membrane. Then you have this spike protein, which is how the virus perforates the cells. A virus cannot actually really live on its own for any significant length of time. It needs to be inside a host cell for it to multiply, and kind of it basically just bursts and releases its material. This is the genetic material of the virus, so it's the viral RNA. So when you've been in contact with somebody with coronavirus, most people will develop symptoms between days 3 to 6, but it can take up to 11 days after that contact for the illness to show up. About 20% of people go on to have no symptoms at all. In 80% of people, it's a mild illness or they have no symptoms, but 1 in 6 people are seriously ill with this. For most people, they may have fever, cough, loss of smell or taste, lethargy, difficulty breathing, muscle aches, and with the current strain, we're seeing a lot of nausea and some diarrhea. However, in some people, it's more severe, and they will experience chest pain, low oxygen levels, feeling faint, and they'll be struggling to complete a sentence in one breath, and those people should be calling 999. According to mathematical modelling, it's estimated that 22% of the population in England have had COVID. So that's about 12.5 million people. However, Test and Trace feels that this is nearer to 2.5 million people, and that's primarily because we weren't testing initially, and also not everybody has had a test. In some areas such as Barking and Dagenham, it's been estimated that about 40 to 50% of the population would have had COVID. In the short term, people may experience loss of taste and smell, flu-like illness, they may get a chest infection or blood clots, they may get something called cytokine storm, which is a flooding of the lungs and organs with inflammation, a heart attack or inflammation of the heart. Longer term, we're seeing this long COVID. This might include things like strokes, blood clots, ongoing breathing difficulties, psychological problems such as anxiety, depression, trauma, and chronic fatigue. What are the risk factors? Well, these include old age, ethnicity, so being from Black or Asian background, being male, and then multiple environmental factors such as deprivation, where you live, how many people there are in your home, whether you're able to socially distance, and whether you're able to stop working because you don't get paid if you don't work. Or if you're in a people-facing job, such as teaching or healthcare workers. In addition, we have obviously diabetes, obesity, underlying heart and lung conditions, low vitamin D, and the shielding category, so those people that were told to shield in the first round. Now, of this, in terms of our community, we can see that being black and ethnic minority, so black and Asian, is a risk factor in itself. But on top of that, we have a lot of these other risk factors such as diabetes, obesity, poverty, which is associated with more sort of general unwellness and heart and lung conditions. Many of us are low in vitamin D, and a lot of our people do work in jobs where they don't have that financial security and live in multi-generational households. So it's even more important that we're very, very careful. So what are the solutions? Well, there's always option number one in any situation, which is do nothing. If we do nothing, the pandemic will continue. It will kill more and more people, and there will be more long-term disability and suffering. We can limit some of that damage, of course, through face-hand space, so wearing a mask, washing our hands, and keeping a 2-metre distance, but that is purely damage limitation. It's not an end to the pandemic. Option number 3 is, well, we say, well, we'll do all of that, but we'll also take some lifestyle measures. So we'll take our vitamin D, we will tackle obesity and diabetes. Again, these things are really important, but they will not reduce the transmission of the virus. They will reduce the severity of the disease. And lastly, what we're trying to achieve is immunisation and achieving something called herd immunity. So this is a process whereby vaccinating enough people in the community means that they no longer pass the virus on to other people. If enough people become immune to the disease, it will stop spreading through the population. So this slide is taken from the World Health Organization, and it has been modified. But in a nutshell, it explains that your body has many ways of fighting germs. But if a germ does enter the body, the immune system becomes triggered and the disease-causing organism is destroyed or removed. Now, when the human body is exposed to a disease-causing organism, it recognises something called the antigen, and it starts to produce antibodies to this antigen. However, in this process, the person can become quite ill. Now, once you've formed an antibody response, you then produce memory cells, so you retain a memory of what that virus looked like, so the next time it happens, you're able to mount a response very quickly and get protected against the disease. So vaccines contain a very weak or inactive part of the organism, the antigen. So in this case, we're looking at the spike protein of the coronavirus, which in itself cannot cause disease, but it's enough to prime the immune system to recognise COVID-19 and mount an immune response. The newer vaccines contain the blueprint for producing the antigens, which allows us to actually mass produce the vaccines very, very quickly, rather than the antigen itself. So this weakened version will not cause disease in the person receiving the vaccine, but will prompt their immune system to respond as it would have on its first reaction. A very good example of a successful vaccination program would be the polio vaccine, and we now know that, for example, Africa is polio-free. So in this diagram, you can see this is a schematic representation. This is the virus. These coloured blobs on the outside are the antigens, so these are the bits that the body will recognise. And here we go, you form some antibodies to these antigens. And if you can see, it's like a key and lock. So the antibody fits very neatly around the antigen, and that allows it to form an antigen-antibody complex and get rid of the virus. So what would we expect from an effective vaccination programme? Well, firstly, we have to be realistic. A vaccination programme could take a year or a couple of years to roll out completely. For it to be effective, we need as many people as possible to opt in order to achieve something called herd immunity. As we know, at present, pregnant ladies and children not included, as well as those people who have had severe allergic reactions or have COVID at the moment. At a personal level, we would expect less severe disease and fewer deaths. At a societal level, we would hope for protection for our loved ones, the vulnerable, sick and elderly, and eventually some sort of restoration of normality. So reopening weddings, congregational worship, social gatherings, going back into the workplace. And of course, this is going to take a very long time. And until we have this herd immunity, enough people are protected, we cannot relax the face-hand space measures. So how is a vaccine designed? So there are various stages. So the first stage is a preclinical study. The preclinical studies, which will take place in animal models, test tubes and labs. At the second level, we have 3 phases of human studies. The first would be small scale. The next stage would be a trial in healthy volunteers. And the third stage is a more natural simulation with large scale studies. It usually takes 10 to 15 years to engineer a vaccine, to actually roll out a vaccine. The actual engineering of the vaccine is a very quick process, but it's usually the bureaucracy, the red tape, the funding, and the trials taking place one after the other that can affect the vaccine rollout. But in this case, what has happened is that all 3 phases of human studies have happened in parallel. Which means that that's cut out a lot of time. There's been a lot of funding, a lot of the bureaucracy has been removed, and this will probably be a blueprint for future vaccination development. Vaccines in the UK are regulated by the MHRA, which ensure that they are safe to be given. So there are 3 main types of vaccines being rolled out in the UK vaccination programme. The first is Pfizer. Pfizer codes for the messenger RNA, which I showed you on the coronavirus diagram. It codes for the spike protein, which leads to an antibody response. Its 2 doses initially was 3 weeks apart, but now we're giving it 12 weeks apart to be able to vaccinate as many people as possible. It's 95% effective, but should not be given to people with severe allergy who carry an EpiPen. The next vaccine is the Oxford vaccine, the AstraZeneca. This is a different type of vaccine. It's based on a weakened chimp coronavirus, which contains the material for the spike protein. It's 70% effective and is not known to have any serious side effects. There are 2 doses 12 weeks apart, and it's currently being rolled out as well. The third vaccine, the Moderna, the UK government has bought 17 million doses. This will not be available until March 2021. It's very similar to the Pfizer vaccine in that it relies on the messenger RNA, so it's one of the newer types of vaccines, and it's very similar in its efficacy. The only difference is really that it's a bit easier to store than the Pfizer vaccine. There are other types of vaccines in the pipeline, but they are still under clinical trials. The UK government had aimed to vaccinate 15 million people by the 15th of February, and vaccination hubs are being set up across the country. What are the side effects of the Pfizer vaccine? So from highest to lowest, most people get a sore arm. I myself had a sore arm for 2 to 3 days. That's about 80%. About 50% will get fatigue, headache, muscle aches, and about 30% will get chills and joint pains. Most people notice side effects after their second dose rather than after the first dose. But there are no side effects here that are irreversible or long-lasting or damaging or harmful. Who will get the Pfizer vaccine first? So at the moment we're prioritising categories 1, 2 and 3, which is essentially older people aged 75 and above or 80 and above, frontline health and social care workers and people in care homes. And most of these people are getting the Pfizer vaccine, although some people are starting to get the AstraZeneca. And after that, probably around the springtime, we'll move on to the over 70s. So I want to go through some vaccine myths. So some people say, well, coronavirus is just like the flu. Actually, coronavirus is 10 times more lethal than the flu and impacts people for longer. You can end up with strokes, blood clots on the lung, chronic lung damage, mental health conditions, and chronic fatigue. So it's not something that you really want to have if you can avoid it. We've already discussed the side effects of the vaccine. Remember, there's nothing irreversible that we're aware of, and we have to weigh it up against the risk of getting COVID. So I would much rather have a sore arm than get COVID. At the time that the vaccine was being rolled out at the time that COVID was presenting in China, the 5G signal was being rolled out in Wuhan. However, these 2 things are a coincidence and there is no link between 5G and coronavirus. There are no harami ingredients, no pork, no alcohol. There are no fetal cells involved. There are no chips or trackers. Some people are worried that the viral DNA will enter our DNA. That's not possible. We are not going to mutate into viruses as a result. The mRNA, the messenger RNA, is a highly unstable molecule. It doesn't enter the cell nucleus, it goes nowhere near it, and that's where our genetic material is housed. And in fact, it's unstable, so it's broken down very quickly. It's just in there long enough to create to trigger the immune system. Does it cause infertility? No. Has it been given to people of black and ethnic minority backgrounds? Yes, it has, and it's been safe, and it's been given to people of black and Asian backgrounds with different health conditions with no adverse effects. Should people who've had coronavirus already still take the vaccine? Absolutely. The quality of the antibodies that are produced are not necessarily very good. They're quite variable. So people that have had the vaccine should still be given people who have had the illness should still be given the vaccine unless they are unwell or deteriorating with COVID. You can find some further information on the COVID-19 vaccination programme in this Public Health England leaflet, which you can find on their website. And if you want to access some more resources, you can access gov.uk or the BAME website and look for COVID leaflets in your own language. Just one last word. Our religion, our faith is one of hope. The Prophet ﷺ brought a message of hope, and Allah subhanahu wa ta'ala creates in us hope of Jannah and hope of goodness in this life and the next life. There is only one way ahead, and that way is for as many of us to get vaccinated against coronavirus so that we can have herd immunity and keep our loved ones safe, keep ourselves safe, and prevent unnecessary death and suffering. Thank you very much for listening to this talk. If you found any benefit, please, it's from Allah subhanahu wa ta'ala, and any mistakes are my own. But please feel free to share this presentation. It may save lives. Okay. All right. Thank you very much.